Hi everyone, I am Dr. Samta Mittal, MDS by education, but not practicing medicine anymore. I took a leap of faith when I joined a health tech company known as Fitterfly more than a year ago. We work in the field of wellness, and last year we started something really wonderful and close to my heart, the HEAL PCOS program, about which I'm going to talk about today. So this is a wonderful platform and I'm looking forward to a very enriching experience here.
Hi everyone, this is Rupal. I am a writer by passion and a tech impact analyst by profession. I I was born and grew up in a town called Gurgaon in Haryana, which is now turned into a big city, the millennial city. So throughout my life, I have had various ups and downs with my health, including asthma as a child. And then in my teenage years, PCOS was a diagnosis I got around the age of 15. And from there on out to right now, to being 26, in the last 11 years with PCOS, I have had a very life changing yet confusing experience. So, here I'm going to talk about my experience as a patient of PCOS and how that impacted various aspects of my life, from my profession to my ability to work out, to my ability to play, to what I eat, to what I can have in terms of what I would call like very life changing aspects of anybody's life, because it's a disease or it's a disorder or it's a part of your life. It seeps into every single aspect, like diabetes, like asthma. It impacts a lot more than just one part of your body, and it changes how you live. So I'm going to talk about that today, and I'm really excited to hear what everyone else has to say. So I would give it over to Ayeshna for that.
Thank you, Rupal. I'm Ayeshna. I am a PhD research scholar, and I'm from Calcutta, but I am based in Mumbai because of my studies. I'm doing my PhD under Dr. Geeta at the University of Mumbai, and I have, of course, I've experienced PCOD myself, and the kind of treatment and diagnosis that I've gone through. I wanted to take that and my own care perspective to the academic circle, and I wanted to theorize on it, and therefore I'm really very very passionate about it, and I would like to bring out the issues that every one of us face in our daily lives who have been diagnosed with PCOD at some point of our lives. So and my PhD is also on this, and my PhD I'm trying to read more and work more on this so that it reaches to other people. So and I'm really thankful to the organizers for having me on the panel, and I'm very very happy to be part of this very very dynamic panel. So thank you. Over to Dr. Tejal. Yeah.
Yeah, nice to meet you, Dr. Samta, Rupal, as well as Ayeshna. My name is Dr. Tejal Lathia. I'm an endocrinologist, and actually, Samta and I collaborated on designing the HEAL PCOS program. So when the Fetterfly people came to me and they said they want to do one more program on diabetes, and I said that enough has been done for patients with diabetes, but there's very little out there for women who are struggling with their health, especially PCOS as well as menopause, and that is how they ventured into PCOS and sometimes done an amazing job for that. But over and above that, I'm not here today as a doctor, but as somebody who understands what girls and women with PCOS go through. I have a lot of PCOS people, girls suffering with PCOS, even in my family. And I hope I'm able to bring that experience to the table. And because I believe that women with PCOS need more support, we're also doing some research work on the mother-daughter relationship in PCOS. And so let's get the ball rolling. Dr. Samta, would you like to share your experience first?
Yes, Dr. Tejal, thank you. Thank you so much. So as I begin, I would like you all to just think about what happens when a family member gets diagnosed with a condition like diabetes or hypertension. She gets the support, the family support, and oftentimes the entire family makes certain changes in the eating habits to show some support to the person who has been diagnosed with diabetes or hypertension. But what happens when a young girl gets diagnosed with PCOS? Best case scenario, she gets the treatment and the support. But more often than not, either she's blamed for being overweight, for being lazy, the reason for having PCOS, or sometimes her concerns are ignored because facial hair or acne, these are not serious problems. This is what girls with PCOS go through, and I know all this because I've been through the same. I was diagnosed with PCOS when I was struggling to conceive about 5 years ago, and my PCOS was in fact diagnosed by a gynecologist who told me that I have polycystic ovaries, put me on metformin, and asked me to try losing some weight. I remember going back home, I went on a strict crash diet, and in about 3 weeks or so, I ended up gaining 2 kgs. I was distraught, lost, didn't know what to do. I went on to have multiple IVFs, but that is another story. So to cut the long story short, PCOS royally messed up many, many years of my life. I often feel that, PCOS is like an iceberg where what you see is just a little part of what actually goes on beneath the surface. So it's not just the symptoms that you see, there is a lot more happening inside a woman that even the doctors are unable to see. So this was the reason when I got the opportunity to, collaborate with Dr. Tejal here and conceptualize and lead the Heal PCOS program. I jumped on it because I really wanted to do something about it. These girls who have PCOS need support, and which was, really lacking in where we are in society right now. So Heal PCOS, just to give you a small idea of what it is, it's a 3-month remote program where we aim to become the education, nutrition, and lifestyle management partner of girls with PCOS. So lifestyle, everybody knows the relevance of lifestyle in PCOS. It's very important to eat healthy, exercise, manage your weight, and things like that. But when it comes to PCOS, a cookie cutter approach does not work. It's the insulin resistance which makes girls gain weight, and when they try to lose weight, it's the same insulin resistance which makes it so difficult to lose it. It's so easy to lose motivation when no matter what you try, you don't get results. And on top of that, all the aesthetics are affected. You have alopecia or hirsutism or acne. Girls hesitate to go out to exercise because of all these reasons or because of obesity. And there is one more other concern when girls stop the treatment because some random family member feels that young girls should not be taking hormonal pills, so they stop the treatment. And my experience has been girls are always lost and confused. I understand the constraints in a medical practice that you have limited time to spend on one appointment, and even if you do spend time, how do you make sure that once the girl leaves your clinic, she is motivated enough, or she keeps the motivation high, or she follows all the modifications or treatments that you suggest? Does she follow that or not? There is no way to find that out. So in Heal PCOS, what we do is we debunk the myths first of all, because PCOS is one condition where I feel that probably has the maximum number of myths surrounding it. So we debunk the myths in a scientific way, and we give personalized care and attention. This hand-holding, which I feel is extremely important for girls with PCOS. So there is a dedicated coach who gives personalized nutrition meal plans, personalized exercise plans, who guides them scientifically by being a buddy in their journey. So it's not like somebody teaching you, because sometimes just having a buddy who understands you and your condition is all that you need. And of course, when it comes to providing education, then again, these are not lectures. So we try to keep it, casual, cool, in form of memes, quizzes, audios, videos, and things like that, which are easy to understand, relatable for girls. So that, you don't realize the way you are actually grasping knowledge about PCOS. So now talking about my experience with other girls, a while ago we did a small survey where we found that 75% of the girls felt that their family or friends do not understand their condition and they lack sufficient support. So 75%, imagine the amount of loneliness out there. Mental well-being is something which is extremely important, and in fact, it's something that should be a part of PCOS management. So girls, even in our program, they want to talk about stress, they talk about peer pressure, they talk about body image issues. So we have been evolving over time, and now we give a lot more attention to tools to tackle stress and manage sleep, self-love, which I feel is extremely important for all the women out there, but specifically more important for girls with PCOS. So that, again, I mean, it's something which I feel deserves a lot more attention than what it currently gets. I will also like to add on some of the results of a recent outcome-based survey that we had. So here, 70.6% of the girls managed to lose weight, and over 43% reported some reduction in acne after joining the program. But the results, which really mean a lot to me, are 76% of the girls said that they started exercising regularly after guidance from us. Over 94% said they started making healthy food choices on a daily basis. 88% felt more capable to manage PCOS on their own. Now, these are the sort of changes which I feel, make the real difference. This is what is going to bring about a long-lasting change. I know that PCOS is not curable, and it's something that you have for the lifetime, but it takes just 3 weeks to form a habit and 3 months for a lifestyle change. So even if in a short span of 3 months, if the women are able to bring about some sort of lifestyle behavior modification, then it can go a long way in their managing of PCOS for the lifetime. I know that getting diagnosed with PCOS is tough, and living with PCOS is tougher. But I truly believe that personalized support and guidance, if it is there, that hand-holding is there, then not only does it empower the women with PCOS, but it can have a really positive impact on treatment compliance and treatment outcomes as well. So this is what has been my story, and it's ongoing. And every day with girls that we have in our program, I get new learnings. And this is something that I wanted to share with you all. I would love to hear your opinion on it and what you feel about, and what are your experiences with PCOS. I would love to hear more from every one of you. Thank you. Rupal, would you like to take it forward from here?
Sure, Samta, thanks a lot. I would actually take one of her points of blaming the person who's been diagnosed with PCOS and start from there. Because for me, if I have to describe my PCOS journey in one word, that is guilt. There was an immense amount of guilt for having been diagnosed with this thing, for having been overweight, for not having regular periods, for having irregular hair on my body, for needing waxing more often than other girls, for not being able to lose weight. This was the beginning of it. And then as I went forward gradually into the years, I reached a place where I what was the moment of awakening for me that this is not okay was that I was living in a state where no matter what I put in my mouth, whether it was a piece of cucumber, whether it was a piece of cake, whether it was whatever, I did not know what it is to eat without feeling guilty. Because there was so much pressure from the doctors and from everybody to lose weight, and I just wasn't being able to do that no matter what I did. So even if I was starving myself, even if I was on crash diets, like more often than not, a crash diet is something you're supposed to do for a very short amount of time to receive a result. But if you're living your life on a crash diet, there is no way to live. So that was what was the moment of awakening for me, because I was just not even being able to eat a regular piece of food, forget about an indulgent item, without having any kind of guilt. Like I was always in a perpetual amount of guilt for eating. And this was about 4 or 5 years ago. So that is when I realized something about my treatment is wrong. So I'm going to go back now that when I was diagnosed about at the age of 15, I was asked to start working to lose weight, and I was given metformin, and I was taking metformin since then for a very long time, even though I kept revisiting the doctor. And I kept trying to stay in touch with it, and everybody kept asking me to lose weight as if that is some magic pill or magic potion, without realizing that I am doing everything I can, without realizing that I'm already on 1200 calorie a day diets, which is very, very straining for a person who is in college, who's trying to, live their life and living alone in a big city. It's very difficult for a person without any familial support to manage all of that, and then also on top of it receive all the blame for not doing good enough. So whenever I would have these issues of I am not being able to keep up, I will be told you're not trying hard enough. If you only wanted it enough. If you only wanted it enough to lose weight. So to the point that I had stopped going to any family gatherings, I'd stopped going to anything that involved my family, because that was the only conversation we ever had. There was no other conversation we ever had. And then eventually trying to find the right doctor took me a huge amount of time as well. I went to, I think, 5 or 6 different doctors before I went to Dr. Beena. And with Dr. Beena, I started to actually find a doctor who was understanding of the problem and not just prescribing me an issue because some hormone somewhere is messed up. And there I realized that, in my journey with Dr. Beena over the last 1.5 years, I've realized that so many of the aspects of my life, which I thought were okay, that is how life is supposed to be, were actually not okay. Things like constantly being anxious is not okay, because that was coming from PCOS. Things like constantly having to think about every piece of food you eat is not okay. Because fine, you're supposed to, eat in a healthy manner, but a healthy manner includes a piece of cake once in a while as much as it includes a banana. Right? So it's supposed to be a balanced thing. Where I realized that physical activity is very important. So instead of just asking me to, go to a gym 2 hours a day and work out like crazy, because I would try to do that and I would fail on the 3rd day, because if you're starting to work out, you obviously cannot work out 2 hours a day. So, trying to find the right balance in how to learn to be physically active as a 24-year-old who has never been physically active in her life, because she could just not keep up with it. Because every time I tried to go to a gym, I would lose touch in maximum a week, because the amount of pressure I would receive from the trainers would be too much for me to handle. So from there to initially, like, coming to a place of just like having like a eureka moment where you realize, oh, things are not supposed to be this way. Like, that is not okay. That is not a way of living. To then sort of re-engineering your entire life and learning to live with something at the center of your life. So today, yes, PCOS is the center of my life in a lot of ways, but in a very good way. It's something which today drives me to say that, okay, I'm going to eat healthy because my body needs that. But also to tell myself that it's okay that, if you cannot do something, if your body cannot sustain something, if you can only do half an hour workout right now, that's it. That's okay. Do half an hour. That's what matters. It's for me learning to really understand those minor growth points as the important growth points and being consistent with them, instead of trying to really take big leaps because everybody kept telling me that you're not doing enough. So I would go back home and try to do enough. But when I went to the right doctor, the doctor told me that you are doing enough. What matters is you have to be consistent with it. What matters is you have to keep going back to it. What matters is that some days you're going to be able to do more and some days you're going to be able to do less. And on top of all of it, what I also figured out is that I have struggled with anxiety, clinical anxiety and depression for a huge part of my life. But all of that came in after PCOS. So I understood that so much of it was linked to my PCOS, even though I don't understand how and why. But a lot of that helped me take my psychological health properly, deal with that properly, and it's exactly like understand that, not everything is coming from a place of needing a medicine. A lot of it is coming from a place of needing somebody who would understand, who would love you, who would care for you, and who would understand what is going on in your body when you possibly don't understand anything at all. So I think that is why I believe it's incredibly important for us as a society to keep talking about PCOS, because it's something we don't understand enough ourselves at all. Like, I would say we don't even understand it at all. Like, like Dr. Samta said, it's like an iceberg. There's so much going on and we only understand the top. And if we don't keep talking about it, the young girls or even people amongst us People get diagnosed with PCOS in their 20s, in their 30s. They don't understand what it means and what is actually going on with them if we don't talk about it. There's so many issues that we would not even understand are linked back to this diagnosis because we never bothered to talk about them. So I think conversation, that is why it makes it conversation becomes very important around this subject because of how unknown it is. And I'm very happy that we are having this conversation here because I don't want to come from a place of wanting to know it all because none of us do. I come from a place of, yes, I was so confused for like 10 years of my life, and today I'm slightly less confused because I found the right doctor who understood the patient and the patient's psychological state as the important part and not just what they weigh on a weighing scale. So I think I would just, end it there, and I would put it forward for Ayeshna. But I would just say that conversation is the most important part no matter what happens.
Thank you, Rupal. And I would, like to take on from what Rupal is saying about finding the right doctor. And my work and my thesis has been, all about understanding the entire discourse of science, okay, and trying to understand if we can sort of incorporate that into the discipline of sociology that I am into. So, to give a brief, I mean, just a two-liners about what is sociology as a subject. It is about understanding the society. It is about understanding the, the mechanisms and the structures within the society that we live in. And of course, the inequalities, the practices that goes on, around us. And as part of, as being part of and being a member of the society, it is very, very important to understand what is happening around us. So from there, I think my own experience of PCOD and the time that I was diagnosed with it, that is when I decided that, I am going to take this forward and try and theorize on it using my own discipline and using my own subject of sociology. And that is what I am trying to do through my PhD as well. um, Coming to the first point which I wanted to discuss is about, this entire scientific angle of a particular disease. Okay, when we call PCOD as a disease, when we call PCOD as a disorder, and I purposely choose not to call it a disorder or a disease, because when you consider something as a disease and when you consider something as a disorder, it immediately means that it is something which is, abnormal in your body. Something is not right within you, something that you must be treated for. And that is what feminism tries to point out, that this is a problem with the entire semantics of a particular disease. So when we are on a panel which is called Semantics of PCOS, it is very important for us to understand the meaning of it, I think. And I think linguistically and in terms of language, science lacks a better understanding of a particular disorder. I don't know how to call PCOD other than calling it, maybe calling it a condition, or other than calling it a disease. But what if you do not want to call it a disease, that you have it in your body? So that is the first thing that I want to start with. The other thing that I want to talk about is my own experience of PCOD. I think I was 14-year-old when suddenly I stopped getting my periods. Constantly for 3 months I was not having my periods, and my mother, she took me to the doctor. And the first thing the doctor said to me and my mother was that, I think there is something wrong with your daughter, and we have to get a pregnancy test done. So yes, we have to get a pregnancy test done. And that is what came to my mind when Dr. Tejal told that, she's working on a mother-daughter relationship, because that came almost like a trauma to my mother, who had accompanied me to the doctor. She was like, what do you mean by getting a pregnancy test done? The doctor said, yes, because your daughter is missing her her periods for continuously 3 months. So as a 14-year-old child, I of course knew what pregnancy meant and how it happened, but I didn't know why these things were being, was suddenly being subjected to me and my own body. And so we we went and I got a pregnancy test done, and then it came negative. So he said that, and it was a male doctor, so he said, okay, now the pregnancy test is negative, so now we need to get an ultrasonography done. So we went to the for the ultrasonography, and the ultrasonography happened, the reports came, and I was diagnosed with PCOD. And then of course he gave me certain medicines, and that entire period in my life has been the most traumatic time, I think, for me, because when we came back home and this was discussed in the family that in a Bengali conservative family, a 14-year-old girl child has gone through this entire pregnancy test and then the ultrasonography, it was a big thing for the family. And the trauma that the family had to face, I'm not yet coming to my own experience of it. So that trauma is something that I think medical science does not does not respond to. So in my own study, I want to explore more about this gap that is there between medicine and the woman's body that is actually being treated. I would next come to feminist science studies, which is another, a field in sociology, which holds or which says that one of the most important premises of any research is a woman's own experience. So when you consider a woman's own experience as the vantage point of your research, when you try to decide that now I'm going to theorize based on a woman's experience and not from the medical treatment or the medical, the medicinal definition of what PCOD is. I think that is something that really will change the entire, the entire idea of PCOS that is there now. Um, of course, taking another example, we've already, I have heard of, I was on the panel which was on the MTP policy and the abortion laws, and in that panel also, we were having similar discussions. um, for example, when a woman, she goes to a clinic for getting an abortion done to get the entire MTP doing, and these reproductive technologies have been very important inventions, in science, in the discipline of science. They are very, very important inventions in terms of reproductive technologies. But what that technology, the effect that technology has on a woman's body, on her own, psychosocial aspect, is very, very important to study, I think. And therefore my thesis is about exploring this gap between science and the gendered body, as we consider that our body is not a singular entity. It is gendered in the sense that the clothes we wear, the jewelry we are putting on, the lipstick that we are wearing, and all these things are making our body a gendered body. Okay, so in that way, is science equipped enough to take into account the considerations of the gendered body? Those are the kinds of questions that I am trying to raise. What is it like to imagine, what is it like to imagine a laywoman's idea about her own body, about her own condition, about PCOD, PCOS? Okay, what is her idea of the disease? What is her idea of the disorder? Is there a possibility to include a woman's own idea of the disease or the disorder within the curriculum of science? And therefore, understanding this very nature of PCOD and PCOS is important. Of course, also this condition of PCOD and PCOS has an entire socio-cultural aspect to it. Your family is involved. The moment people get to know that we have PCOD, which means that there will be difficulties in bearing a child, in conceiving. What kind of what kind of effect does the family have on it? I mean, what kind of psychosocial trauma that the girl goes through it? Okay, so these are the kinds of things that should be discussed, and I'm very, very happy that doctors and medical practitioners are taking up this issue, because we should move forward and go beyond the clinic and understand these conditions. It is not only if we keep on prescribing, if we keep on giving medicines to the patients, is that enough? Going back to what, for example, Rupal is talking about, or Samta is talking about, it is the same thing, that finding the right doctor is very, very important, who is going to understand the condition with empathy. and not, you know, with a scientific gaze. And this PCOD and PCOS also, I think the kind of gaze that doctors have on the body, it is like, you know, objectifying a woman's body and constructing it around science and not around her experience. So I think the experience of PCOD should be brought in, because the nature of disease is such that, you know, the women's body has to definitely go through these scientific an ultrasonography or blood test. And, you know, the nature of the disease is such that you have to have medicines. There is no other way of treating it. That the body has to go through scientific experimentations and medications and technological testings. But mm, which all you know, which might happen to the woman without her consent. Am I really asking the woman who's going to have an abortion, or who's going to take the hormonal pills, whether you want to take it or you don't want to take it, whether you want to go on to the crash diets or you don't want to go to the crash diets? Okay. So I'll give you another example. When my elder sister was diagnosed with PCOD, and the doctor, she was a lady doctor, and she told my sister that, you know, the only way to cure PCOD is you have to get married at an early age. I think in another 1 or 2 years you should get married, and that is how your PCOD will be cured. And I think till today I'm trying to figure out as to how that will work. That, you know, getting married at an early age, how is that an answer to curing PCOD? And she, of course, her parents went on to look for a groom for her, and, you know, the marriage was fixed. And when she told this to her husband, to her would-be husband, that, you know, she has PCOD and she's on medications, the marriage, I mean, they suspended it. They said that we don't want to, get our son married to this girl, because you know, in the future conceive karne mein problems hogi. So these are and then the girl was subjected to a lot of blame, that, you know, it is because of you that you know, you're not being able to get married now. How will we find a groom for you? And all these things, of course, followed. So these are the kinds of I think psychosocial pressures that are there, which comes along with a disorder like PCOD, which medical science does not respond to. So, you know, that is something that we are referring. I mean, that is something that I wanted to talk about. And I hope that through my thesis and, you know, through the studies that I'm trying to do, I am able to come to a point where we can integrate these various points into my own research. So yeah, with that, I think I will go to Dr. Tejal and open the discussions to her. Thank you.
Thanks, Ayeshna. So yeah, then maybe I should say that my dream is that all doctors should be the right doctor, so that we sensitize and educate doctors enough that any doctor you go to should be able to treat and approach PCOS in the right way. So of course, I'm going to defend the medical community, but I'm not doing it in a place from where I feel that you're blaming us. But what I realized is that our medical school curriculum is woefully inadequate. It does not at any point address communication. At any point, there's no subject which says this is how you communicate with the patient, this is how you explain the diagnosis to them, or this is how you talk to somebody when they first diagnosed with something. So, you know, this is the first problem, and this is not only with PCOS, it's with every aspect of medicine, be it diabetes, be it menopause, whatever it is. The doctors are not equipped enough to deal with communication. The second thing is what you said about the scientific gaze. Now, unfortunately, that is what is expected of us throughout our training, to listen to the symptoms, make a diagnosis, write a list of investigations, and treat the patient. So that is the XYZ pattern of treatment that we have learned. Now, if you're fortunate to be somebody like Dr. Beena or myself who understand that that is not enough and there's so much more to a condition than just making the diagnosis and giving the treatment, then this is what you call as the right doctor. But I guess what is really needed, and I hope through your thesis we'll be able to maybe take the message forward of how we need to look beyond just the label that we put on the person and what it really means in their entire life for them. So that's the second thing I wanted to say. The third thing I also wanted to say is, um, up until now, the way that the medical community works is you go to a doctor, you show your report, they make a diagnosis, and they tell you what to do, right? This is how it goes. There was no concept of shared decision making, of actually asking the woman that, these are your treatment options, in what would you like to do? Also, doctors get very defensive when patients say no for treatment. The reason this happens is because doctors themselves feel useless or inadequate if they're not able to offer treatment, because that's what we became a doctor for, to make people's lives better. So that means writing medications. And when a patient says that, no, I don't want to take this medication, doctors take it very personally. They don't seem to understand that it's the right of the patient to decide what they put into their body. Yes, it may not be the scientifically correct decision, but it may be the correct decision for her in the context of her life. And that's a choice and power that she has and deserves. It's not my job to make the decision. It's my job to offer you the options and for you to make the decision about your life. And then we work together, not from a place of, oh, you didn't listen to what I said and look, now your health is worse. But okay, that's the decision you took with what knowledge you had at that time. And if it didn't work, okay, what can we do next? So that's very important for doctors. They feed off doing something. They don't know when it's okay to not do something. Just listen to the patient. Empathetic listening is also a therapeutic tool. And just listen to her issues, try to offer solutions. If they don't work for her, go back to the drawing board and start all over again. So that's another point I wanted to make. And as you said, that is science prepared to, really look at the person in a different way? No, science is completely unprepared at this present time, is completely unprepared. If you have a brief glimpse into what kind of conversations go on in medical communities, so science is, as of now, at least for vast majority of doctors, they're completely unaware of that. This entire, like Samta said, the iceberg phenomena, let me reinterpret it. So only that small tip of doctors are there who now realize that you need to go beyond making diagnosis and treatment. And hopefully the iceberg will start coming out of the water as time goes by, and we should be able to make a difference. So to maybe defend myself and put my strengthening my being a doctor. So I do realize that there are a lot of aspects to polycystic ovarian syndrome, and one of them is the mother-daughter relationship. Now let me tell you where I was coming from. So most of the time, the usual patient with PCOS who comes to me, what happens unfortunately is most of the younger girls go to gynecologists. So by the time these girls grow up and they do net searches and they find out that maybe I should see an endocrinologist, they're already into their 20s. Now, when the girls come to us, I'm talking about a young 20, 21-year-old college-going kid. For her, the most important aspect is the excessive hair, or it's the acne, or it's the scalp hair loss, and I try to discuss treatment options with them, which will best help them with the cosmetic part. And the cosmetic part is a very big part to play in the way a girl feels about herself. Now, unfortunately, what happens is the minute I start talking about treatment, most of the times the mother is very concerned about the fact that hormonal pills will prevent her from getting pregnant in the future. Her mother probably, because the purse strings, the financial purse strings are with the parents, the girl lacks autonomy to decide that what part of treatment she wants to focus on. She wants to do laser, but it's expensive, and a lot of times parents don't think it's important enough to do the laser. वो आंटी को भी तो बाल थे, so what difference does it make? You understand? So what I struggle with is trying to attend to the girl who is my patient, but at the same time fighting the battle with the mother, trying to explain to her why it's important to offer the cosmetic treatment, why it's important to offer the hormonal medication so that she feels better about herself. The mothers are always looking at the future. And I don't blame the mothers at all. They're coming from a place of they're so afraid what society will do to their daughters if they're not married on time and don't produce the 2.5 children by a particular age. So mothers are agonized and traumatized by the fact that their daughter will have a hard time in the future. But generations have gone ahead now, and girls don't think only about getting married and having children sometime in the future. They want to have a good quality of life now. They want to look good. They want to feel good. and they want to be happy now rather than in some distant future. So for me as a doctor, it's very difficult to come to terms with this, where these two worlds collide of the mother's expectations and the daughter's expectations. And of course, Ayeshna and Rupal, I've had mothers who in front of me who've been blaming the child, saying she's very lazy, she doesn't listen to me, and all of those things. So it's very difficult in one single clinic visit to, of course, manage all of this. But with my research, I hope to find out where exactly is it the mothers are coming from. And hopefully, that now after the research and what I find, when mother daughter pairs come back into the clinic, I'll be able to talk to them better. Of course, one of the biggest telling findings of the study is, before we've analyzed the study, is if 5 girls were recruited, at least 4 of the mothers refused to talk to us. And most of the time, the mothers would give reasons for non-participation as, we don't want to talk about things like this on the phone. We are too busy with domestic chores and we don't have time. I'm not interested. And so these were the most common reasons. So what was very telling about the research is, before we even started to investigate the mother-daughter relationship, a lot of the mothers are, for whatever reasons, they don't want to talk to the doctor, probably, and it was not a doctor who was interviewing them, it was a psychologist. They don't want to really get into it. They just want to like be on the surface and just make sure uske periods regular kar do and we'll get married, right? So I have great empathy for the young girls with PCOS who struggle with us, and hopefully there will be more doctors like Beena and me. And after having conversations with amazing women like you, hopefully we'll be able to take the message forward. And I also think that a lot of the women also just don't get PCOS. So, you expect that when you go to a lady doctor, she would probably do a better job, but somehow it's not always true, and I think it's also an unfair thing to expect that, a woman doctor should understand more than a male doctor. I think as a patient, all doctors should be equally able to, respond to your needs. So hopefully we'll be able to do that in future. So, Dr. Beena, you're here. So all of us have had a little bit of say about everything, and would you like to chime in?
Sure. I would have loved to listen to the whole conversation. I missed Samta's completely. I heard yours a bit, and Rupal, of course, I keep hearing from you. So it is both ways, Rupal. We learn from each other. Whatever I do is from what I gain from other people. I don't think it's me who kind of gave you anything. You were already on a path to finding yourself. You were actually of that age. I just happened to be there. So I just do nothing most of the times and let people do whatever they're doing. So that works. And lucky for me, that has worked for many of them. So on the same tone, I think, so as Ayeshna rightly said, we have been actually, while studying all the years, polycystic ovary syndrome was also my thesis topic, and I was studying the prevalence of glucose intolerance, and then I did a study MRI of those girls, and we wanted to see the proportion of visceral versus subcutaneous fat and to see the pathological reasons behind it. So on one hand, it was very clinical, but on other hand, it did give me an opportunity to talk to a lot of girls because we had recruited 200 girls in that group. But what I was there while I was doing that study and what I have learned over last several years is much different. So where I am right now, I would accept that there was a time when it was difficult because once a parent, or usually parents would bring their daughters, and my experience has been different. Maybe Gurgaon mothers are a little more sensible. They are really nice with their kids. I mean, so one of the PCOS girls, I should have called her. She's just 15-year-old. And she has actually given, because we were collecting stories, she has given her artwork. And it's so matured. She has reflected in her sketches so much of her feelings of PCOS. It's amazing. Just a 15-year-old girl who knows so much, and her mother has allowed that journey. So I think kids in general have become much more matured at a younger age. The parents are more allowing them to understand themselves better. They're not enforcing things. So it's a different thing which we see now. At least in different cities, it is different, I suppose, because in smaller cities, it's still very, very conservative thing versus in other cities. So, um, so number one, usually mothers allow the daughters to talk, or they are concerned that, so some mothers are still saying that बहुत सारे बाल हैं और वजन घटाना है. But I think as a doctor, so from all of this, what we should be doing, maybe patients should tell us that this is what you should be doing. So I think what we should be doing is we should talking to doctors to sensitize them, as Tejal said. We should be maybe making a small workshop or course on how to speak to people and then take an approval from patients whether this looks okay. Number three, we should let the girl decide whether they are really affected by that hirsutism, because even now I think that is one of the conflict areas, that the medicine part, because one, PCOS is very common. So it is not even 10%, it's more than that, considering that if we just base on ultrasound evidence of multiple cysts in ovaries, because ultrasound have become more sensitive, and lots of girls unnecessarily now are being diagnosed as PCOS, especially in the adolescent age group. The criteria should be very stringent, because adolescent PCOS is a separate thing. Girls may have irregular periods for 2 years, definitely even more for 5 years. So first 5 years, whether you should be labeling them as PCOS is a question. And that is being asked. So adolescent PCOS is a different category. We do not use the same criteria for diagnosing them. They may be having multiple cysts in ovaries, but still not have PCOS. So that is one aspect of semantics. So PCOS is not all of these which come to us. Many of them do not have PCOS. So every week I see 2-3 people who I have to just communicate to the girls that you're completely normal. The cyst can be in me also, in anyone else also, because cysts can be commonly seen, considering that ultrasound has become very smart in detecting cysts. So if we don't strictly follow the updated criteria for ultrasound, we end up actually diagnosing 50% of girls as having PCOS. So many girls would come unnecessarily thinking that they are not normal. So one part is that. Secondly, weight. A 15-year-old girl, actually now we had a conversation, very long conversation in the morning on obesity. And one of the things which came out is, so one, it is not a personal issue, weight gain. Weight gain, we give too much of agency to a person, that you have gained weight, you lose it. So the first thing which we tell to a 15-year-old girl, she is not responsible for her weight. How can a 15-year-old girl, till now her mother has been feeding her, she has her own genetic, epigenetic factors. So weight gain actually starts in the womb, and the genetics, when it combines with all the environment which we are in, so there are so many factors. It's very complex. The complexity is right now beyond any solution. What we can do as doctors is stop telling, especially young girls or anyone, that to lose weight.
I agree completely.
2 reasons. One, they are not responsible for the weight gain. Second, it is not easy to lose weight. So you put them on a track which you know is really a difficult track. You tell them to lose weight, only 0.8% will be able to lose weight, because the body doesn't allow losing weight. And you know that fact. So what you need to tell them is, okay, let's work on what you're eating, how much you're exercising, and can we work there? Let's not give them goals for weight loss. Let's not make it very result oriented. Let's make it process oriented. So number one, the choice whether they want to go with that hair or not. I used to have, actually, I am not a PCOS person probably. I'm not sure. I get confused because I used to have a lot of hair, and it was partly ethnic. I had some irregular cycles. Now they have regularized, and I was fat as a kid. So probably no one diagnosed me luckily, but I have that experience of, as a school child, I never noticed that I have excessive hair. And even now I remember a friend's remark that आपके चेहरे पे ना ये लाल लाल दाने और हरे हरे बाल बहुत अच्छे लगते हैं. So I was happy with that comment. I mean, that was the thing. But when I went to medical college, where you should be actually addressing these and the teachers should know about it better, people started pointing out that you should be doing something about it. And I started bleaching. And there is a tradition in medical college. I'm speaking it on public, but it was public anyways. After Holi especially, we would put a list and we'll it would be an anonymous list, and there will be things written about people. You will put labels for people. It was the
Wow.
worst form of bullying. And the comment for me was Satasat, which was a Gillette ad. Because the first time when I
Ouch.
reached, it was looking like that. I mean, suddenly you change, na? What, I cried so much after that. And so I have undergone a process of laser. I now feel that maybe I should not have. I preach everyone else that you should accept the way you are, and I still don't have the courage to go the way I am all the time. I tried to lose a lot of weight over the years. Now I have become a little more comfortable and not trying to do that and eat what I love to eat. Uh, but I think so. These struggles are real because how it is perceived, and in medical college, it's a very toxic culture. The looks of girls, boys don't matter. So you are actually objectifying girls by saying them keep wazan kam karo or chehra saaf karo. Why is that need there? So that need we should question. Doctors should not reinforce that norm. So because we have been talking about gender norms, and this is one of the most it's a normal thing. So if you see Frida Kahlo's painting, she is now one of my inspirations. That when I look at her painting, I wish I had seen her before. I didn't know about her till a few years back, and then I realized my birth date and her birth date are same, and it's a proud thing for me because she is amazing. Uh, you have seen her self portraits, na, with the mustache and the what do you call the
Unibrow.
hair? It's it's the way she portrayed her beauty out there. So I think we should give these examples to the girls and not what the popular culture is showing girls as thin and beautiful and all whatever. So it's easy for me to say, but because right now I am fitting into that thing, I sometimes don't look very good also. Tejal, I've seen that one or two very bad videos of me also because I go into that phase and I sometimes enjoy doing that when I don't have to try and look okay. So that is my personal comment. Sorry, it is. I have. This is the fourth lecture, and I am totally lost now. So please, someone.
Don't worry. So we'll go ahead. So, Samta, do you have anything to say about after you've heard Rupal and Ayeshna speak?
So it was, every time I hear somebody's experience, it's always, something new that I learn about. And there were so many nice things that, that guilt thing that somehow
Yeah,
it's
I
just
loved what Rupal said about the
and
guilt and
you
blame.
are responsible. I felt guilty because I wasn't able to conceive. Like, it's not my fault, right? And then some young girl is feeling guilty because she's overweight. That guilt is so deeply ingrained. And definitely when she used that word, it just hit home. Yes, exactly, that's what I felt. So yeah, and as you know, as both of you have been saying, empathy and sensitizing doctors is it's going to go a long way when talking about patients. One more thing that I felt was, see, all of us here are patients of PCOS. Rupal, of course, is sharing her experience. I am working in the field, but I am a patient of PCOS. Ayeshna is doing a PhD. She's a patient of PCOS. But maybe we just need to go out and talk more about PCOS so people who do not have this condition still know what it means. It's not
Right.
just polycystic ovarian syndrome. It's much more than that, and everybody knows that. And like you said, it's such a common condition. So more people should know about it, and it's just something that I strongly feel that talking more about it and spreading more knowledge about it is probably definitely the need of the hour.
Rupal, you want to say something? Round two, anything, any comments?
Yes, sure thing. So actually, I would
Rupal, you're not audible. Rupal?
I think it's frozen. Her screen has frozen.
No problem. Ayeshna, you want to go ahead and Rupal comes back?
sorry, I'm so sorry. I think I dropped off. Am I audible now?
Yes, you are, Rupal. Go ahead.
Yeah, so I would actually want to make two or three actually interlinked comments and take from all of your conversations. And I would take from Dr. Beena's and Dr. Tejal's conversation and talk about the doctor
Rupal is rejoining, no issues. Ayeshna, go ahead.
Um so the first thing that I wanted to regarding what Dr. Samta said, that this healing PCOS program is something that, healing is something that I think I'm hearing from a doctor for the first time. Whenever you go to the doctor, I think prescribing becomes much more important than healing. And as a patient, and on the other side of the table, I think this healing PCOS is very, very important. And I think you're right when you're saying that we should talk more, and we should talk, and it starts from the family. We should talk more to the family and to everybody, to our friends, to people, that that it's a condition, and it is okay to have it. It is okay to have hair. It is okay to be overweight. Until it is harming you. I think what Dr. Samta said was a very holistic view of PCOS, that you give them psychological help, you talk to them, you give them certain opportunities. And regarding what Rupal said, of course, I've related to what Rupal said very, very much. I think what she has gone through is very much what I have also gone through. The guilt is there, the anxiety, the blaming yourself is of course there. Um, uh, because I think it is as I also said, that the nature of the disease is such, that you have to go through these medications. And it is very after I had those pills, actually after those pills, I lost most of my hair. I got acne, and the only treatment that the doctor used to tell me was, you lose weight and it will be cured. So is there an alternative to that? Is losing weight, why does this become so very important, that I am not being able to come to terms even today? When today I go out and say to my friends, to my family, that I absolutely have no problem with my weight, they look at me like, that you don't have a problem with being fat. I said, no, I don't have a problem with being fat. And some of them even tell me that, because you cannot lose weight, this is what you say to to give yourself a satisfaction. And so I cannot just explain it to them that it is okay to to be this way, and it is okay to feel like this. And I think what Dr. Beena and Dr. Tejal said, that you all are doing a great job, and empathy is something that is very, very important to bring in, especially into people who have this condition of PCOD and PCOS. And thank you, Dr. Beena, again for for this for taking this issue on. So yeah.
This losing weight thing now, I just wanted to make a comment on that. And Ayeshna, I totally hear you, from my soul, when you say about the losing weight thing. And time and again, I've explained to mothers as well as daughters that losing weight is not the golden, that pot of gold at the end of the rainbow. Losing weight can improve the metabolic profile of PCOS. Yes, it may delay development or prevent development of diabetes, but it is not going to cure the PCOS. And we must not place this huge burden on young shoulders, that you are responsible for your disease, and because you haven't lost weight, you're not better. I think we really need to change this conversation. And I think also somehow, Beena, we need to do something where we can sensitize gynecologists, because what happens is girls don't come to us at 14, 15, 16, 17. If it's an urban city like Bombay, still they would come. But most of my experience has been that every PCOS patient who ultimately comes to me has seen at least 4 gynecologists to 5 gynecologists before seeing me. And endocrinology is still a science where we do look a lot at psychology and patient feelings, because we deal with transgender and other things. But yes, Ashna, yes, please go ahead.
This is actually the first time that I got to know that one should go to an endocrinologist, even before you go to a gynecologist, because that is never. That has never. This is this knowledge this should reach girls, because the moment they know that, okay, it's some problem to do with the period. with the vagina and with the ovaries, they think that they should go to the gynecologist. And I think the gynac problem is of course there, but what you said, that the
It's a syndrome, right, Aishna? There's so many other aspects to it.
many other aspects to it, that that the girls who are on the other side, like me and like Rupal, I mean, this is the first time actually I mean, I got to know this.
So
So
it's not the mother's fault, because when there's a problem with the period, you go to a gynecologist. It's not their fault. But what I was also trying to highlight is there's even difference in the training between an endocrinologist and a gynecologist. See, gynecologists are basically surgeons. They, more than even medicine specialty, are taught to do something. You understand, it's a huge amount of pressure on a doctor to do something, and that is why most of the time they end up writing medications, because they feel they need to do something. Doctors need, I think, to be taught that it's okay to not do something also, but just listen to the girl, allay her fears, explain what PCOS means, and give them reasonable targets. This lose weight thing, I totally understand, is something we really need to get out of our curriculum. Beena, anything to say with that?
Quickly comment on what Ayeshna said. Do I
Yes.
need to lose weight? So my answer to that is, and there is more and more medical data on that, which is that, see, the term obesity or weight, what weight is wrong, was defined many years back, that at this
Right.
BMI, these are the complications, and that thing is shifting already. And probably the BMI criteria needs to be changed, because now there is a Danish study which says that 28 kg per meter square is probably the optimum BMI rather than 25. There may be many explanations. Secondly, at each weight, ultimately the amount of exercise and the type of diet, the lifestyle, which is what would so at a lower weight versus at a higher weight, if you say, if we divide into two categories, someone who is having, I don't want to use that, not so good lifestyle versus a good lifestyle, and here also that. So in the sequence, in the thing, lifestyle would weigh in before BMI there. So a good lifestyle and a low weight, followed by good lifestyle and a higher weight, followed by poor lifestyle and a lower weight, followed by poor lifestyle. So it is both these factors which are important. So weight is something which is probably not in our control, but what is in our control, we'll try to work on that.
Right.
With all the problems, we know that the environment is not supportive. We know there are other things. PCOS develops because of so many different reasons, but that is the answer. So doesn't matter if you're overweight, but maybe going for 15 minutes walk, it has its own advantages. So as a doctor, I think it is wise for us to advise that for sure. That, have you tried
Yes.
that, and what are the barriers? So each visit is talking about those things, and Rupal will tell me, because she's an inspiration for me. She said gym, and she does to us every day. Even now, I know that.
Hi, I'm so sorry about the internet situation. It's raining here terribly. Uh, so yeah, I would actually just take from everyone's points, and the first thing I would say is I love the amount of head nodding and like, yes, we know this feeling that is going on this call, because almost everyone is sort of empathizing with everything that we're talking about. And I think doctors really need to empathize that way too. But taking from Dr. Tejal's points, there is a lot of change that needs to happen in how doctors are trained. And the reason I can say that is because I come from a family of doctors. Like every elder in my parents' generation in my family is a doctor. But it's hilarious to see how they deal with patients versus themselves. So if some member of the family who's not a doctor gets diabetes, oh, it's their fault, oh, they should just take the medicine, oh, they should just stop eating this and that, and like a huge list you can give them. But if one of the doctors gets diabetes or hypertension or any of those issues, then it's a whole different story, and it's a whole different circus that happens, because they just can't believe that it happened to them, and they just cannot understand what is going on. And the most hilarious one for me was that my dad operates on people all the time, like all the time. But when my mother had to go through an operation a couple of years ago, he freaked the hell out, to the point that it was as if the idea of surgery is so scary that he cannot understand what's going to happen, despite doing that like part of his day all the time. So I think it's when doctors go through that experience themselves that they understand that, when the doctor in charge was not giving him answers, how he felt,
Yes.
versus when he doesn't give answers to people or just tells them to wait, regardless of how long it's been. That is a very different story altogether. So the sensitization has to be there, and that is where the social elements and psychological elements of a society as a whole come in. And it has to do with the fact that we are not talking about things enough. So from moving from the doctor angle to moving to the angle of what we do to the people about their weight, about obviously making it the person's fault instead of recognizing there are so many social, economic, and different angles that go there. Losing weight is an economically costly thing, and not everybody can afford that. Not everyone can afford to eat healthy either, because it costs a lot, and sometimes a few people in the society cannot afford that. If you have a big family and you're earning in a limited manner, you cannot afford to feed everybody a nicely prepared salad with lettuce and avocados every day, right? So it's something which takes a lot of money. It takes a lot of a gym membership costs. Sure, you can ideally go out and work out in a park, but who does that? Like, let's talk practical sense here and not like something idealized out of like the idea of studying under, you can study under a lampshade also, but we don't expect people to do that.
Right.
So therein we have to realize there's so much that is wrong about our eating habits, not because of we are people that way, but because of the fact that we as a society function that way, and we as a society create certain kind of meals which have become traditional and which have become the woman's responsibility. So if they have become the woman's responsibility in the house, she's gonna do them in a hurry, and she's not gonna have time to be creative with cooking your beetroots and your beans and doing this and that and feeding you all the nice greens in a way that you find them tasty. So that is where also comes the element of not just for women but for men learning to cook, learning to know where your food is coming from, learning to understand. You don't just walk into a supermarket and pick up something and you're done there. That is not how it works. That is societal change we need. And I think that rolls on from there. I would actually move on to my third point, which goes on to an experience that Ayeshna narrated about getting the pregnancy test. And there I would talk about how our entire system, be it the familial system, be it the societal system, or be it the medical system, fails the patient when it comes to privacy. I, as a 24-year-old, had to take a pregnancy test because my periods would just be in such a situation where I would get a lot of overbleeding when I do have my periods. Otherwise, it would be a lot of pain for me if the bleeding was normal. So once I had such bad bleeding that I had to be taken to the hospital in the middle of the night because the bleeding was just so bad, I felt like I was going to faint. And like I had run through, I don't know how many tampons that one evening, like half a pack of tampons in an entire evening. So there the doctors wanted to do a pregnancy test, and I was fine with it. As an individual, I'm fine with it. I'm fine talking about, my sexuality or my possible pregnancy or lack thereof with the doctor. But I don't want my family members hearing that. I don't want them standing right next to me.
1 second, Rupal. This is a question I wanted to ask both of you. Did anybody ask you if you were sexually active?
They did, but in front of the entire family.
Yes.
And Ayeshna was
right
told,
place to
so
ask
I
that
think they
question.
didn't even bother to ask that, right?
Oh, the first doctor didn't even bother to ask me because I was just 14 and
No, but then others, how would you get pregnant? You are not Mother Mary, right? So
exactly. So no, they did not ask me. But the second doctor that I went to, in front of my mother, the doctor asked me that, what about your sexual life? Are you sexually active? So that has happened to me.
your mother freaked out.
Yes, my mother freaked out. She even freaks
Sorry.
out today.
I'm
Yeah.
so sorry for that experience. Yeah, and then they asked you in front of your whole family whether they were sexually active.
Yes. Also, not just my immediate family. Actually, my immediate family does not live in the same town as me. My parents don't. So it was an extended family who was essentially like my mother's sister's husband's brother. And having this questioning in front of that person, and I know it's gonna turn into a family fairy tale by the morning, which is essentially gonna like bring me 2000 questions, but that is not where I want to have that conversation. So that entire idea of who you can have conversations with and take decisions with, the reason I was able to take my own decisions with Dr. Beena was because I was the only person there. I was financially capable of affording a doctor, and I'm gonna like really say this is a privilege for me that I could afford a doctor, I could afford the medication, I could afford anything and everything I wanted, and that is the only way I could get the care I wanted for myself, because not because I had not been taken to a doctor before, or not because my family couldn't afford a doctor, But because every time I went to a doctor before this, the story was about them and not about me. The story was about she doesn't do this, she doesn't do that, इसको ये समझाओ, उसको वो समझाओ, इसको कुछ नहीं समझ में आता है, हम बोल बोल के थक गए हैं, कोई और बोलेगा तो समझ में आएगा, and all of that. It was never about the fact that I also had questions about my own body. It was never about the fact that I am telling you I'm doing something, but somebody sitting right next to me is telling me that I'm telling them that I'm not doing it, and they are listening to, the doctor is listening to my parents instead of listening to a very grown up 20 something year old person.
Absolutely.
So yeah, so I think that came as a privilege. So this should not be a privilege. This again needs a societal framework change, that being able to make your own medical decisions and ask your own medical questions should not be a privilege. You should not only have to do that when you can afford, quote unquote, a healthy diet or a healthy doctor, or any of those things. So coming down to the point of, again, bringing it back to the idea of conversation, it's only when we talk about these things that we'll sensitize people, that we'll highlight why not everyone can afford to be a certain weight, and I don't think everyone should. The last time I met Dr. Beena, I was at 64 kgs, which was a 10 kg plus loss for me. But I have put on weight since then because of the lockdown and all of that. But I'm gonna sit and say that the 1.5 kgs I've put on is completely fine, because the world has practically been on fire and we have been all locked inside our homes. So there has to be that understanding that I am not scared to go back to Dr. Beena's office a couple of months from now, because she's not gonna berate me because I put on things. But in the past, if I ever went to a doctor and I'd put on even half a kg of weight, I know I was going to get berated without any questioning of why this happened. But you did not try hard enough. So what? You could have done this. You could have done that. Use your time to do this. So it's like always an idealization of the scenario, but a complete lack of empathy in what you're going to feel when you are in it.
And also that doctors say lose weight, but I also find, Beena, don't you think we don't give people tools to lose the weight? We don't give them any tools. We just tell them आप 5 किलो वजन कम कर दो सब ठीक हो जाए, लेकिन कैसे करना है? Where do I start? So I think that's a very big part of the problem, is not offering tools, to take care of the PCOS. This is what I think. So if we, I think, we are well past our time, so we'll briefly summarize what everybody had to say. And we'll start with Samta. And I think the Heal PCOS program is a start, at least in some way, to provide support for patients with PCOS. But what Samta and I both realized is that our program needs to evolve to also involve a lot of psychological counseling, because a lot of the girls were psychologically very distressed and we didn't have much to offer them in terms of that. And we are working with another endocrinologist, and we're trying to work with another psychologist who has a team with her, and we're trying if we could organize some meetings between girls with psychologists, how to deal with stress, how to deal with problems with body image, and hopefully we'll be able to help them with that. Rupal, I love the fact that you say it with so much of humor, whatever you've recounted, and also because you come from a family of doctors. So it's not like you're completely naive, and you've seen both aspects of the care and how doctors flip out when somebody from their own family is ill. So I think that's wonderful insights you've given us, and hopefully we can take this forward. And I think Beena and I will agree if we could do more workshops with doctors where we have patient representatives, who, when you hear it in the first person from the person who's experienced it, and you realize as a doctor, like, oh shit, I should go and hide somewhere, asking a 14-year-old to do a pregnancy test, asking you in front of some cousin brother that whether you're sexually active or not, are really things that we need to learn from. So Rupal, your points are all very well taken, and I apologize for some of the doctors that you met, and I hope you'll be able to do a better job in future. Ayeshna, I think it's so wonderful that because you have gone through it, you've taken up studying PCOS as your PhD project. And Dr. Beena and I are open, any help you need from us, any collaboration you need from us. But I think it's amazing to try to reconcile medicine with what the patient really feels and goes through. And I love that point you made when you said you were okay with being overweight, but people were not okay with being overweight. And I don't know what to say to that. Somehow it means that you're just putting up an excuse because you can't lose weight. But I think it's perfectly okay to be however you are. And doctors also need, and this Beena made that point, so we have something which is called as patient important hirsutism. Now, that's the only place in PCOS where the patient is really considered whether the excessive hair on the face is relevant to the patient or not. And have really nice young 16-year-olds who say, ye baal nahi, nothing, I don't feel anything about it. And then there are some girls who have two hair on their, face, and they're agonized by it. So that is very important, that to interpret the symptom on what relevance it has for that person's life, how it affects their quality of life, and then take the treatment from there. So I think it's been a great conversation. Beena, you have any last few words of wisdom to share, or we can close it here and hope for a better future for girls with PCOS?
Yes.
Yeah, so I think you have really put in pearls of wisdom there. I don't consider myself wise enough to comment on anything. I think the reason why this conversation is here is because I wanted to learn from different people, because our conversation styles are different. For example, I really wanted to understand the sociological aspect, which I am understanding now more. As doctors, we have been told to always know everything, always speak from a place of certainty and confidence. And that I'm trying to move away from. I'm trying to go to areas where I'm not certain, I have doubts, and be humble enough to then learn. Otherwise, there's no place for growing up. So there are so many important concepts about body image and female body and norms, and whether to call it a disorder or not a disorder, because till now I was trying to explain to the patient, nahi nahi, ye bilkul ek disease nahi hai, ye ek disorder hai. I thought I'm making it milder, but I think even that, now I'm changing my
Hormonal imbalance.
vocabulary.
Can we call it a
Not
hormonal
imbalance.
Yes.
There is nothing wrong is the first thing which should come out from our mouths, actually. So there is a whole discussion on disability next time, which puts in perspective who is normal, who is abnormal, who is able, who is not. It's not a binary, like nothing is a binary, it's a spectrum. So maybe no one is normal. Who defines what is normal? Who defines how much hair can we have? Who defines how
something
much
to
weight can we
communicate,
have?
right, Beena? We can't just leave
Condition.
everything to
She gave us a word condition. So I think maybe we should start
condition.
with that.
Yeah.
We should not medicalize many of these things,
Yes.
which I think it comes so easy for us. It's very easy for me to do that, which I have been trained for years and I have learned over years. And now unlearning all that and doing a new kind of conversation is difficult, because I have to watch every word coming out of my mind. But I think that is the only way to work through this. So we should definitely try and not stigmatize anyone walking into the clinic. You don't have to say it. Sometimes it's just the way we look at it, as she's saying, the gaze.
Scientific gaze.
Because imagine we used to do those FG scoring without even asking in government institutes.
Yes.
Everyone, you have to score all the hair on the body. And I was and examine all different types of things. There was hardly any space for privacy, consent, and the comfort it needs over a period of time. But we have been going through that process during our pregnancies and all. So then we realize how it is to be gazed into the bodies in ways in which we do not want to be. So I think there are things which we need to learn and discuss and grow out of it. And unless medical specialties and practitioners become humble enough to accept their limitations and try to explore other areas and have more of these conversations, because what we do is we teach, we educate. It's not about exploring. So we should not try to educate anyone, because I think we are all on the learning curve at different places. We are from different areas, not at different levels. We are just different perspectives. So I'm just trying to make myself as uncertain as possible over a period of time, and I hope that works.
It's okay for doctors to be vulnerable. It's okay for them to not know everything. So that's what we need to unlearn first, and then probably learn new things. Unlearning is the bigger challenge. Learning is not a problem for doctors. We're so good at learning. We have so many textbooks and we just learn really quickly.
Actually, it's not our fault. It's none of the doctor's fault. The amount of information we have been put on our heads, and there is a certain way we kind of adopted from the system. So,
and the importance of this conversation is, Beena, that they also understand that the intention is never bad. The intention is always to help, but only thing is we don't know the right way to help. So I've just finished my project on diabetes, and this is communication in diabetes. So how I've laid out the entire document is intention of the doctor, what they say, and what people hear. This is where the problem is. The problem is in the translation. The doctor wants to say something to help the patient, but he says it in such a way which lands completely in the wrong fashion to the person. And that person is like, I'll die, but I'm not going to listen to what he's saying. You understand? So, though our intentions are good, we need to learn to communicate those intentions in the right way. So we have a chapter is what we say is not equal to what people hear. It's completely different. Doctors assume they're saying A, but they're actually saying Z. And they have no clue that they're saying Z. They think they're saying A. So they're completely unaware of the impact their words and their gestures, their body language, the tone of their voice has on the opposite person. They're completely unaware. And Rupal, you will agree with this, your own family members, they're completely unaware, they don't even understand that they're so hilarious.
Yeah, I would completely agree with that. And what I would also like to say is that it's not just a lack of communication understanding, it's also a lack of understanding that the other person is going to come into this picture with their own preconceived notions. So when you tell somebody it's a disorder or a disease, you might not think it's a wrong thing to have because you deal with it on a daily basis, but for somebody else it could be a huge deal. So, changing the word to something like a condition or something neutral could be very helpful, because the first thing you're doing is you're removing the subtle messaging there that there's something wrong with you. Like when I say my car broke down versus, oh, my gear is a little ticklish and it's not working fine. They're two very different sentences. One clearly says there's something wrong with the car, and the other says, oh, my the gear just works, this way, just move it to the sideways and it will be fine. So
So we
that
discovered that
That
we
is where I
diabetes.
think the role of the doctor is also so important, because after listening to what Rupal has to say, what Dr. Beena, I mean, I really wish that I had a doctor like Dr. Beena, or I had a doctor like Dr. Tejal or Dr. Samta. I mean, then my PCOS journey as a patient would have been a lot better. I mean, thing that that I would refer to than what I'm doing now. So yeah.
But PCOS girls are really smart, okay? Because somehow these girls, they talk to each other and more of them find us, right? Beena, I'm sure you've had that. You go to that doctor, she explains very nicely. Then they don't want to go to anybody else.
So actually, you might not know this, but there are these sort of underground list of doctors that are available on the internet right now for PCOS, for
Where is
psychology,
it?
for gynecology.
Who
These
not
are
to go to?
yeah, who to go to,
Oh,
because
okay.
essentially, like, there's so much stigma around all of these types of medicine, that like with gynecology we've had horrendous experiences. So whenever we want to look at a doctor or we want to explore a doctor, there are these underground lists which are available on Facebook, and you can just Google some of them, like doctors to go to, and like, I don't remember the right keyword, but essentially, like, there are these lists where you can find people. So there people will put their own experiences with the doctors, that okay, what are the good parts about the doctor, what is not okay with the doctor, or what, like, it's essentially very personal, and it's essentially very critical in good ways and bad ways. And a lot of people on the internet, like especially woke women in metro cities, would look at those lists before going to a doctor, unless they're in an emergency.
So can I end this whole conversation with one last experience? So, I always try to, tell patients as well as I can. And I have some really good reviews on Practo. So like I have some, good reviews, but I had this one bad review. It was like a completely bad review, and it was from a patient with PCOS. And she said that the doctor told me that my PCOS is not curable. How dare she tell me that the PCOS is not curable? She's a useless doctor. She charged me money and then she's telling me that my disease is not curable. So the only reason I'm saying this is that what happens is I don't want this to be a process of doctors being blamed all the time, but it's also a two-way street. So, when you come to a doctor and you keep them up there and you expect them to give you the answer to all your problems, and when they aren't able to do that, to blame the doctor is not really fair. So, what I'm trying to say is it works also both ways. A lot of times, what happens, doctors come from their own negative experiences that they've had with other patients and with with whatever, and because of that they start off playing defensive. They just want to protect themselves because they're so afraid of what will happen. So I thought that I was doing the right thing by explaining to that particular person that, see, there is no magical cure. She'd been to many doctors, but in her state of mind at that time, she was not ready or open enough to accept the fact that, it's not curable. And I'm not bad at communication. If Samta knows that how I speak to people, and I've treated lots of her relatives and all. So for me, that was such a shock, like I agonized over that review for weeks, and I wanted to write a counter response and things like that. And of course, I controlled myself. So what I meant to say is that doctors need to be kinder to patients, and patients also need to be kinder to doctors. And that's how we'll close the session.
It was lovely connecting with everyone.
Yes.
We really
Thank
enjoyed
you.
it.
Thank you again,
Yeah.
everyone. Thank you for this.
Thank you, everyone. Have a wonderful evening.
Same to you.
Thank you, Dr. Beena. Thank you, Dr. Tejal. Thank you, Ayeshna, Rupal.